In this video, we will be discussing how does the VA conduct the knee range of motion exam. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. How does VA conduct a range of motion measurement? Essentially, if you are being assessed for knee pain, you will be asked to flex your knee. You are bringing your heel to your sit bone's gluteal muscle. The practitioner can then use the goniometer to measure your joint angle once you come to a stopping point, or what is called end of range of motion. Similarly, you will be asked to extend your knee, increase the joint angle at the knee such that you bring your toes away from your body like you are kicking out or taking a step. The practitioner will use a goniometer to see how far out you can extend your knee. When being asked to move your impacted joint, it is important to stop as soon as you feel pain or cannot go any further. Do not force it if you cannot go to 140 degrees of flexion or bring your foot back towards your sitting bones. The VA practitioner will take the measurement using the goniometer at the point where you stop or express pain. That is how your ROM at the knee joint would be scored. What is active range of motion? This is about how much the knee can bend and straighten on its own, that is, knee muscles actively contracting without any external help, usually performed by the patient independently, and when the patient is able to voluntarily contract, control, and coordinate a movement. What is passive range of motion? This is about how far the knee can bend and straighten when moved by an external force, usually another person. Usually performed when the patient is unable or not permitted to move the body part. What is repetitive use range of motion? Repetitive use range of motion refers to the degree of movement a joint can comfortably perform during repetitive or prolonged activities. It assesses how well a joint functions with repeated use and sustained motion. In the context of disability evaluations, such as those conducted by the VA, Veterans Affairs, understanding repetitive use range of motion is essential to assess the impact of joint limitations on daily activities and work-related tasks over time. It helps determine the extent of disability or impairment a person may experience due to limitations in the joint's repetitive use capabilities. What is flexion endpoint? The flexion endpoint of the knee is the maximum angle of bending or flexion that can be achieved by the knee joint. It is measured by determining the degree of knee flexion, usually using a goniometer, a tool specifically designed for measuring joint angles. The goniometer is aligned with the axis of the knee joint, and the angle is read at the point where the knee is maximally flexed. What is extension endpoint? The extension endpoint is the maximum angle of straightening or extension that the knee joint can achieve. This is also measured using a goniometer, aligning it with the axis of the knee joint and reading the angle when the knee is fully extended. What is adduction and abduction movement? Adduction is the movement of a limb or body part inward toward the body. The abduction movement involves a limb moving away from the body. During a knee range of motion exam, the patient will typically be seated or lying down. The examiner, often a trained healthcare professional such as a physician or physical therapist, will guide the patient through a series of movements to assess the knee's flexibility. The examiner will use a goniometer, a device resembling a protractor, to measure the angles formed by the knee during specific motions. The patient can expect the examiner to instruct them to perform movements like bending and straightening the knee, as well as possibly rotating the lower leg. It's important for the patient to communicate any discomfort or limitations they experience during the exam. This information helps the examiner accurately evaluate the knee's range of motion and ensures that the patient's concerns are taken into consideration in the overall assessment. Overall, the knee range of motion exam is a non-invasive process designed to understand the joint's flexibility and any potential limitations. Thank you for watching this video. Please don't forget to subscribe and like our videos.